skill number 1 in the pharmacy science event, and this is called patient screening form for pharmacist consultation and services. So first, make sure you greet the patient and introduce yourself. Hi, I'm Lauren. I'm your pharmacy technician today. If you could verify your name and date of birth for me.
August 22nd, 1983, Katie Meyer.
All right, so then you will write that down on your screening checklist form, the patient's name and their date of birth. Make sure that you're doing this either with a low tone of voice or in a private area, as to make sure that you're not giving out any personal information. There are multiple different scenarios for this skill. For this example, we're going to be doing the late refill scenario, which there are 5 questions for. When you are asking the questions, make sure there's no distracting elements like a lack of eye contact, inappropriate facial expressions, or body posture that seems closed or forces the patient away from you. Avoid the use of medical jargon, which is fancy words, during the discussion with the patient. Speak with appropriate volume, pitch, inflection, and pronunciation of the words. Actively listen and do not interrupt while the patient is talking. Question the patient as needed to ensure that the responses were completely understood. And then sign the patient screening form. So for the late refill example, these 5 questions include: so I noticed you're not making all of your refills and that you're refilling your prescription a little late. How did the prescriber recommend you take this medication?
I'm supposed to take it daily.
Okay. What methods do you use to help you remember to take your medication every day?
I don't really have a method, so sometimes I forget.
Okay. What side effects have you experienced when you miss some doses?
I start to feel kind of weak.
Okay. Do you believe that the medication helps resolve those issues when you do take it on time?
It does, yeah.
Okay. What are your concerns regarding taking this medication?
It's just kind of expensive, and so I try to stretch it out a little bit.
Okay. And then from there, you can give some suggestions on how they may be able to take their doses better so that they're not refilling their prescription late and that they're taking it the way that is intended. After you finish out your patient screening form, hand it to the judge. And that is it.